Hi, I'm Dr. Jack Schaeffer, and today is probably one of the proudest moments of my life. We've talked about Birmingham and Schaeffer Eye Center being part of this city, but nothing's more part of the city than when you have your family. Birmingham's about families, and today I have my family with me at Schaeffer Eye Center. So first, I'm going to introduce everybody. I have Justin Kaplan, Executive Vice President and proud son-in-law, or really son. We don't have son-in-laws. My daughter, Brooke Schaeffer Kaplan, who, as you can see, is pregnant with our third grandchild, which is hopefully will join Schaeffer Eye Center one day. And Mark Schaeffer, who also is graduated optometry school, and this year spent a year in residency at Baskin Palmer Eye Institute. And I'm just excited. First of all, Brooke graduated yesterday, so she is, if you notice, they don't have their names on the jackets because I'm not sure if y'all are going to make it yet. They're too new to know. So Justin and I will make that decision later in life if y'all can perform properly as doctors. But first of all, sitting here with the three of y'all just makes my day, and I think it's an important day for Schaeffer Eye Center. It's an important day for the whole city. So Mark, since you're sitting next to me and you're the middle son, and Beth always says, you gotta give him the extra because he's the middle son. We're gonna talk to you first. A year at Baskin Palmer Eye Institute. Now, for y'all who do not know, Mark graduated from Southern College of Optometry in Memphis, and they spent a year at Baskin Palmer Eye Institute, which is the #1 eye institute in the world. Tell us a little bit about your experience, and what are you going to bring back to Schaeffer Eye Center?
So this year has been an incredible experience for me, just to be in such a well-respected hospital in Miami. I mean, it's one of those referral centers that gets patients from all over the world. I mean, we have the world's renowned tumor specialists, the world-renowned glaucoma specialists, and when you read the books and when you go to their lectures, these are the people that are leading the field. These are the people that are creating that technology that is cutting edge and breaking through the barriers to treatment so that we can better treat our patients.
And what is, of all those, what was your favorite specialty? And again, how is that going to help you when you go into practice in 3 weeks?
So my personal favorite had to have been the neuro-ophthalmology service. I think that when you take a look at the eye, it's so small and something that we can focus an entire practice just based upon the eye, but the eye is a part of the whole complex system of your body. And you can't really do anything in the eye that doesn't affect the brain, and vice versa. The things in the brain can also affect the eye. So solving that mystery as to things like headaches and things like tumors and any sort of other problems that you can have can be traced back to your brain. And we have the technology here to sort of help find those problems that may be lurking that you may not know about yet.
A lot of people get concerned. We have headaches, and one of the things through the neuro-ophthalmology and neuro-optometry and all the things that you've learned, you're going to bring some expertise, and I can't wait. Now also, Mark is going to bring a sports vision department to Schaeffer Eye Center. This is something that's been important to everybody right now about sports vision, and talk about the 3 parts of sports vision.
The first is obviously kind of training that hand-eye coordination and taking a healthy athlete and putting him in a better visual environment to succeed. Wide receiver Larry Fitzgerald is actually a product of the sports vision program. Not through Schaeffer Eye Center, obviously, because we haven't started it, but sort of similar training can be done to make a great athlete an exceptional athlete. The other part is sports trauma. So all sports have some level of contact, and the opportunity for something to arise is greater in some sports, and to be able to recognize any sort of traumas on the field and address those that moment so that we can better get them the care that they need. And then the third would be the rehabilitation of those trauma patients. So people who have any sort of problem from the sports injury, to get them back to not only where they were, but even better performing than they were.
And that's what we're excited about. As we know, there's a lot of work on concussions, especially people in high school and junior high school with head injuries. And we know there are eye tests that really can determine when these people are ready to get back. And so the Schaeffer Sports Vision section will handle those issues and work with the orthopedic surgeons and the trainers around Birmingham and other areas to really bring us something special. Next, I have Dr. Brooke Kaplan Schaeffer. So it's supposed to be Brooke Schaeffer Kaplan, but I don't want to confuse everybody because I love having Dr. Schaeffer. That's going to be really confusing for Justin to figure out with our people that book appointments. I know one of your important things is diabetes. Tell us what you think you're going to be doing with diabetes, because we at Schaeffer Eye Center have been working on a diabetic program for years, and finally we have Dr. Kaplan that's going to develop the entire program. Tell us a little bit about the diabetic program.
Well, my goals for our diabetic protocol are really threefold. First is providing the best medical care for our patients. Diabetes can affect the entire body and especially the eye, and you can see so much going on in the eye, and as long as we get a good look in there, which we do with all of our patients, we can get a handle on how our diabetic patients are taking care of themselves. Secondly, I want to have coordinated care with their primary care physicians and their endocrinologist, or whoever is their primary provider for diabetes, to make sure that we're all on the same page and know exactly where our patients stand. And third and most importantly is educating our patients, because the more educated the patients are, the better and more proactive they'll be with their health care. And
again, this is something that's just so exciting, because we know with a diabetic, we can save them. We know that every diabetic we see today, if they're young enough and take care of themselves, they will have a normal life. If they do not, the consequences are just horrible, as we all see in the programs. I know you were at UAB. Do you want to talk a little bit about your training at UAB and what that does for you in Birmingham, Alabama?
Well, I am very lucky to have gone to UAB School of Optometry, especially here in Birmingham, because Birmingham is home and has always been home. So to be able to come back here and make the connections with the city again as an adult and bring my family back here and raise them in this wonderful community has just been an incredible experience.
And Brooke will also be working on our Infant C program. The American Optometric Association has a great program that all infants should be examined. So they set up a program called Infant C, and every young newborn baby can have a free eye exam all over Birmingham. And Brooke will be helping Schaeffer Eye Center get more involved in the Infant C program with our 17 doctors, because again, it's all about helping the patients live a happy, healthy life. And in the program as of today, about 6% of all the babies have been examined have had problems that were solved, including brain tumors picked up in children that would have been missed, literally saved lives. So I'm really excited that you're going to help Schaeffer Eye Center with our infancy program and the American Optometric Association. So now you've heard from the doctors in the family, but when you have doctors, somebody has to control us. You got to have somebody that really is making us be normal. So Justin, tell us, you're part of this family and you've been with us for a long time, and actually you came long before they did. Right. So
I feel like I helped put them through optometry school.
You did. How do you fit in, and what are you bringing to this table to have to live with this kind of white coat individual?
Well, first of all, it's a little bit difficult sitting here without a white coat on, because she already makes fun of me. I do have a Juris Doctorate, but I've been told that's not a real doctorate. So I've been dealing with that now for a few years already, and this doesn't help in this environment. But hey, at least I have a suit on. So it's a pleasure. I mean, I'm personally really excited about having more Schaeffers and Schaeffer Kaplans, or whatever you're supposed to call my wife, his daughter, however it works out. But as part of this,
well, it's my show. She's my daughter first.
That's right. Well, this is my turn. I thought I was going to get a shot.
Oh, that's right. Go ahead.
All right. So but one of the things that excites me is being able to help lead this practice. This practice is so unique because we don't have stores in this place. We have offices. And that's something that's really important to who we are, because it's much more about taking care of you, our patients, than it is about it's not about sales. It's really about the medical side of the practice. And Mark and Brooke both, Dr. Schaeffer and Dr. Schaeffer Kaplan, are both very interested in helping us build the medical side of our practice, which is what really sets us apart from, I think, most of a lot of other businesses who do this, because we truly care about the medical side of what we do, and helping guide us in that direction is very important to me.
And what Justin was saying is just so important, because as we sit here with the family, you know, we all know this, we all understand, but we hear all the time, you know, how are you different than other people out there? Because there's a lot of places that sell glasses, and you know, Schaeffer Eye Center is known to having the best glasses, but that's not who we are. We're about medical care. We're about taking care of your eyes for a lifetime. Not only you, your entire family. And that's something we've stressed so much. When you come to Schaeffer Eye Center, you're coming for the eye exam. That's number one always, because you know that if you come here for an eye exam, if you have a medical condition, we're going to discover what it is. And if you have a disease like glaucoma, we have some of the best glaucoma people in our practice to make sure that you get the best care, because we know, especially with the kind of training we have, and not just with the family, but all the doctors here, that it's about making sure we keep you healthy. Glasses are secondary, and I know that a lot of people, when you think of Schaeffer Eye Center, you're thinking, wow, cool glasses. Well, we do have cool glasses, but more importantly, we have cool doctors, and our doctors care about you. And hopefully, you know, with the family in here, I know all the doctors are excited about having more Schaeffers. They don't want any more of me, that's for sure. But they do want some more great Schaeffers that are sitting here taking care of patients. So again, this is a proud day of my life. I mean, I love this family. It just, you know, it's just too hard to explain. And it's funny, I was sitting here, I've been doing these shows for so many years. To sit here and interview your children with white coats on is really tough. The cameras don't bother me, but y'all do. But this is just wonderful, and I hope you come enjoy the family with us. I mean, Schaeffer Eye Center is about Birmingham. It's about the state of Alabama. We're here for you, and we're here for our community. So we look forward to seeing you or seeing any one of the Schaeffer family. Thank you.